Assalamu alaikum. In this video, we will understand about the diarrhea. So, what is the diarrhea and what is their symptom and complication? Let's begin to understand about all this story. So, diarrhea is occur when your stools are loose and watery. So, the water type stool, and you may also need to go to the bathroom more often, and the diarrheal time duration for normally 1 to 2 days, but the excessive days will lead to chronic diarrhea, but the short term acute. The sign and symptom of the common sign and symptom of the diarrhea is can cause fever due to the viral infection or bacterial infection, while on the other hand the abdominal pain as well as the anhydrobiosis, the cell injury will occur due to the loss of water because the not absorption of the water from digestive system into the blood circulatory system, and dehydration will lead to hypotension, and stomach pain can arise due to the many complications, and swelling of the abdomen due to the large intestine, and the bloating can cause the blood in the stool, and leaking stool and not being able to hold, while the swelling of the abdomen is known as bloating and cause pain and upset the stomach is lead to nausea and urgent need to bathroom. Let's understand about the diarrhea. The type of diarrhea. No. The diarrhea type is two, the short term and long term. Short term is the acute diarrhea, while the long term is the chronic diarrhea. For short term acute diarrhea is the diarrhea that lasts 1 to 2 days and go away. It can be occur by bacterial infection or viral infection, the virus, sickness. Bacteria will change the microbiome, and the excessive harmful microbiome development and growth of that bacteria will lead to cause diarrhea, and we can control. On the other hand, the long-term chronic mean the long term. The long-term diarrhea is that which lasts several weeks. This may be caused by another health problems such as irritable bowel syndrome. We will discuss in the next video about the irritable bowel syndrome. It can also be caused by an intestinal disease such as Crohn's disease. I have video about the Crohn's disease. You can watch by the search and write with the umer, or celiac disease and parasitic infection. So I have also the celiac disease video. Cause of diarrhea is basically, let's understand about the causes of the diarrhea. Then we will understand about the serious side effect of diarrhea chronically. The causes of diarrhea can be are several, like bacterial infection and the viral infection, the food intolerance. The food intolerance means the milk or wheat, the gluten allergy or other type will it cause celiac disease. Parasite in the food like pork and beef. And on the other hand, the food allergy and gluten and celiac will lead to cause diarrhea. On the other hand, the irritable bowel syndrome will lead to cause diarrhea, and the reaction to medicine and intestinal disease. On the other hand, the surgery of gall and stomach, and the recent antibiotic use and thyroid problems. The prevention of this is sanitizers. Wash your hand often. Use alcohol-based sanitizer and eat proper cooks food and water boiled. Because when you will eat food contaminated or eat with the contaminated hand, will lead to ingest that virus and bacteria will lead to cause diarrhea. The serious side effect of diarrhea is the feeling thirsty, headache, dry mouth, weight loss, and fast heart rate due to the electrolyte imbalance, because electrolyte is not absorbing like potassium and magnesium as well as calcium. And the having dry skin and tired and rashes on the skin can also appear, and dry skin, not urine often, because urine will not produce when the hypotension will occur and due to the dehydration. Anyhow, the diagnosis of this is the stool culture and stool studies, including culture and other tests. On the other hand, the blood test for identification of the bacteria, if the bacteria are present in the blood circulatory system, and other purposes. The treatment is the antibiotic plus fasting. The diagnosis also involve the endoscopy and sigmoidoscopy, the colonoscopy through anal side. So the imaging test and fasting test is used for the identification of the diarrheal cause and the dehydration and the organ damage, and fasting is the complication. Fainting is the complication. The major complication is the dehydration, the weak immune system due to the less working and the dehydration and hydrobiosis. And the shock can occur, low blood pressure lead to renal failure and tissue injury as well as muscle spasm due to the calcium homeostasis will not possible, and the injury of the cell of the muscle, loss of the consciousness, and the pain in stomach. The complication of dehydration on the basis of the cellular level. In this way, the basically is the bacteria, the microbiome is very important for absorption of certain type of nutrient like micronutrients will not move. So the less water will lead to anhydrobiosis, will lead to mitochondrial dysfunction due to the decrease of the ATP. Due to the decrease of the ATP, the calcium will lead to apoptosis and necrosis, because the calcium will move more into the cell and shrink cell to die and apoptosis and necrosis. Because the calcium imbalances and other things will lead to cause apoptosis, necrotic apoptosis. In this way, it will lead to shock, ischemia, heart failure, tissue injury, neurodegeneration, and neuropathy, fatigue, faint, nausea, vomiting, and skin wrinkled. Anyhow, I hope you make sense about that. What is the diarrhea? Diarrhea is caused due to the viral and bacterial infection or other, which that will lead to not absorb water into the blood circulatory system, will lead to dehydration, and this stool will be watery and will lead to cause many complications like not absorption of food, etc. Thanks for watching. If you like my video, please make sure to subscribe, like, and share. Bye.